Hello and welcome to this video on the function of the heart. The heart is a vital organ in the human body, responsible for pumping blood and oxygen to all parts of the body. In this video, we will explore the structure of the heart, the process of blood circulation, and the role of the heart in maintaining overall health. Let's start by looking at the structure of the heart. The heart is a muscular organ located in the chest, slightly to the left of the center. It is roughly the size of a fist and weighs around 11 ounces. The heart is divided into 4 chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. The atria are the upper chambers of the heart, while the ventricles are the lower chambers. The right atrium receives deoxygenated blood from the body and pumps it into the right ventricle. From there, the right ventricle pumps the blood to the lungs, where it picks up oxygen and releases carbon dioxide. The oxygen-rich blood then returns to the heart via the left atrium and is pumped out to the rest of the body by the left ventricle. The heart is made up of 3 layers: the epicardium, the myocardium, and the endocardium. The epicardium is the outer layer of the heart and is made up of connective tissue. The myocardium is the middle layer and is made up of thick, muscular tissue that contracts to pump blood. The endocardium is the inner layer of the heart and is made up of smooth tissue that lines the chambers and valves. Now let's look at the process of blood circulation. The heart's primary function is to pump blood throughout the body, delivering oxygen and nutrients to the cells and removing waste products. Blood circulation begins when deoxygenated blood enters the heart through the superior and inferior vena cavae and flows into the right atrium. The right atrium contracts, pushing the blood through the tricuspid valve and into the right ventricle. The right ventricle contracts, pushing the blood through the pulmonary valve and into the pulmonary artery, which leads to the lungs. In the lungs, the blood picks up oxygen and releases carbon dioxide through the process of respiration. Oxygen-rich blood then returns to the heart via the pulmonary veins and flows into the left atrium. The left atrium contracts, pushing the blood through the mitral valve and into the left ventricle. The left ventricle contracts, pumping the blood through the aortic valve and into the aorta, which is the body's largest artery. From there, the blood flows to the rest of the body, delivering oxygen and nutrients to the cells. The heart is also responsible for regulating blood pressure. Blood pressure is the force of blood against the walls of the arteries as it flows through the body. High blood pressure can cause damage to the arteries and increase the risk of heart disease and stroke. The heart maintains blood pressure by contracting and relaxing in a coordinated rhythm, known as the cardiac cycle. During the cardiac cycle, the heart goes through 2 phases: diastole and systole. Diastole is the relaxation phase, during which the heart fills with blood. Systole is the contraction phase, during which the heart pumps blood out to the rest of the body. The heart rate, or the number of times the heart beats per minute, can vary depending on factors such as age, fitness level, and overall health. Conclusion. In conclusion, the heart is a vital organ that plays a critical role in maintaining overall health. Its main function is to pump